Can you feel that?
Yes, I can feel it.
What I want you to do, sir,
Yes, sir.
is to be bending forwards, all the way forward, and then come back, and then bend back for me, backwards. All the way back, arch your back, yes. Now bend forwards. Now come back. Forward. Back. Forwards. Good. All the way back. Is the light okay for you? It's okay?
Yeah, it's okay.
Good. Now, sir, I want you to bend to side. Keep your bottom on the bench.
Okay.
I want you to bend maximum this side and maximum to the other side. What we're doing is we're continually moving the spine.
Okay.
We're trying to get the sacroiliac joint, the lumbar facets, and the nerve roots. And we want it to penetrate through to the disc as well. We want to get all the soft tissue structures and get light energy into there. Alright, that's going to help with the healing of it. So 1, 2, 3, bending side to side. And other side. Other side. And again. And again. And again. And again. And again. Okay. Now I want you to do the same, twisting, stay put and twist all the way around towards me. Keep bottom on the ground and twist full, maximum to me, and then the other side. Go. And switch. 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 Full turn. Good. Switch. Switch. Last one. Switch. Good. And back to facing the front. Excellent. Right then. Turn to the side, facing the door. Lie on your back. Give yourself a hug. Relax the arms. Perfect. Come on up for me, sir. You felt that, right?
When I wake up it pain. When I get up from the bed, no, then it pains a lot. Yes.
Yes, yes.